Hi, it's the nursing professor here. I want to talk to you today about the NCLEX first time pass rates are in the toilet. And so when I look at this, there's several factors that contribute to that. And I want to discuss some of those. Now, I know all on the internet, I know students, I know you love to point the fingers, but hear me out. Just hear me out. So first, I think instructors are being hired because there's such a shortage in nurse educators. With that, instructors are not coming with educational experience. And many of them have not even taught anything in a hospital setting. There's very limited mentorship that's provided them, so they might not be as equipped as they should be. So if I take a job and I'm new at it, I'm that person that's going to ask questions, but everybody is not me. And so it just makes me think that from a university standpoint or from a nursing school standpoint, we need to do better to ensure that faculty are prepared to teach our students. All right, that's just one. Number two, clinical instructors. Yeah, I know people don't like to talk about this, but this is the truth. Because you are a nurse yourself, you get at least a master's degree, does not mean, again, that you are equipped to teach students. We know that since COVID, things have changed in hospital settings. There's a lot more limitations placed on the nursing professor as they bring students in for their clinical rotations. So with that, you really do need the help of staff nurses to help in the education of your students. I can't tell you the number of times I've heard from a staff nurse, I don't want a student. I mean, that's well within their right to say they don't want a student, but it just makes me wonder, who taught you? Because at one point we were all students. So this is what I propose as a solution for that. That universities, nursing schools partner with acute care facilities, hospitals, or long-term care facilities, but wherever your nursing student is going to be, you partner with that facility such that nurses can be incentivized. So they're at work anyway, and perhaps the university can come up with some sort of additional hourly pay for them as they help to educate our students. Because the truth is this, a lot of times in clinical settings, it is an observational experience until you get to that last semester. Observational experiences are not helping our students at all. With new NCLEX, we're trying to build clinical judgment. So if you're just observing another nurse do something, then you're not building your clinical judgment skills. You're not engaged. You're not involved. And yes, some students are successful, but those are students who are able to be assertive and take on a particular role. I watch this all the time. You'll notice that some students hang back, especially when they hear from a nurse staff member that they don't want a student today. So I would say that needs to change. Students. This one I know you're not going to want to hear, but you are an adult learner. And I don't know if there is a nurse you will find that will say that they have never had an instructor who was just not good. Is it your responsibility? Some of it is a shared responsibility, because the truth is this, you're given a syllabus at the beginning of every semester. It tells you what needs to be done. You're responsible for those assignments. You're responsible for preparing for the test. And the truth is this, if you actually prepare for those things, you're going to have questions. And regardless of how poor of a professor that you have, then you're going to come with those questions, and that professor will have to answer those questions. If you're not getting your questions answered, what do you think you should do next? What I say you should do is you should go to your dean. Don't let it just sit there and fester. And then when you're not successful that semester, then your excuse is, oh, this teacher was terrible. She never came. She never was there for her office hours. She gave us too many slides. You can go down the whole list of things that professors do that are not useful to students. But what I do say is this. I see too often students don't say anything unless it personally impacts them. And usually you don't hear the complaint until the very end of the semester. At that point, it's really, one against one. Professor says this, student says that. Professor says this, student says that. And so there's really no real solution that can happen for that student that particular semester. So think about this. If you find that you're faced with that, then address it early on. If you don't get a solution from your professor, go to your advisor, have a conversation. If you don't get a solution from that, then go to the dean. You can make an appointment with the dean, and you need to say exactly what is actually going on. You need to have examples such that it can be addressed. No one is infallible. No one is. But if the proper people don't know about a certain technique that's not being done in order to improve performance for students, then they can't do anything about it. Last, I'm going to say this to you all students. You have several resources. I mean, you have class, you have your textbook. Every textbook has an online tool that accompanies it. You have ATI, you have HESI, you have Elsevier, you have all these supportive programs that are there to really help you be successful throughout your nursing program. But many times, again, I can't tell you this enough, I will ask a student, did they use any of those programs? And the answer is no. And then I'll ask, well, where are you getting your questions from? Online. A lot of questions I see, there are tons of nursing influencers online, but everybody is not a teacher. I have to say it. They just aren't. There's a lot of people out there that continue to give these knowledge-based questions that no one's going to ask you on the NCLEX. NCLEX is about clinical judgment. It's about making safe decisions. It's about prioritizing what you should do as you care for a patient. As I always say this, I create scenarios so that you're looking at a patient on paper, because that's what NCLEX is all about. So I want you really to digest this information. You can do this. You have the tools necessary, but don't get caught up in pointing the finger everywhere else except with you, because schools are in business to make money, yes, but for your success. These schools that do not have successful outcomes for their students, nobody wants to go there. And when you're researching the you're researching the school in which you want to attend, I beg you, please, to look at their NCLEX pass rates. Because why do I want to go to a school that has a 50% pass rate? It's not going to benefit you. All right, so I hope that helps. If you have any other suggestions, or you disagree, or you want further conversation about this, because we do need to do something. It's an unexplainable phenomena at this time, while the NCLEX rates have dropped so fast. And it's not that it's just next gen ed questions. That is not the only reason, because next gen ed questions have been out there for a couple of years now. So let's talk about this. Let's do better. Let's get you all trained in passing the NCLEX so that you can join the healthcare world and be able to help patients, which is what we're all in the business of doing. So I will see you next video. Please like and share. And I really do look forward to your comments, and I'll see you next video. Bye for now.